And action. Knock, knock, knock.
Hello, come in.
Hi,
Hi.
I'm Diana, and I'm going to be your nurse today.
Okay.
Yeah, can you tell me your name?
I'm Tamsin Ross.
All right, what's your date of birth, Tamsin?
2/13/1990.
All righty, I checked that against your armband.
Okay.
That all matches. I'm going to check it on my computer here, make sure I got everything correct. Yeah, that sounds great. And you have, I see the band on here says no allergies, is that correct?
That's correct.
Great,
Mhm.
all right. Well, what brings you to the hospital today?
I was having some stomach pain, kind of some achy abdominal pain yesterday.
Oh, I'm sorry.
Yeah.
How long did that last?
Like 3 to 4 hours.
Oh, wow, long time. Is there anything that brought that in particular that you feel like brought that on?
I don't know, I went out for some Mexican food the night before. It could have been spicy food,
Okay.
perhaps.
Was there anything that made it better?
Just lying down, resting, and
Okay.
drinking some water.
Okay. And whereabout is your pain on your belly?
Kind of like right in this region.
Okay. Okay.
Lower abdomen.
Okay. I'll be extra careful when I examine that area then. And can you describe the pain? There's different words people sometimes use to describe pain, maybe burning, aching, dull, stabbing.
More aching pain.
Aching, okay,
Yeah.
okay. And the pain from 0 to 10, if 0 is no pain and 10 is like the worst imaginable pain, what number would you give that pain when you had it?
Probably like a 6, 6.5.
Okay. And has it come back since that first episode?
No.
Yay.
it hasn't.
So no pain right
So,
now?
Yeah.
Okay.
No pain today.
Okay.
Yeah.
And no Mexican food for a while, maybe?
No.
Okay, awesome. All right. Well, now I know while you're here, I'm going to start with my examination. And is there any concerns you have before we get started? Anything you need to talk to me about?
No.
No?
Not that
Okay.
I can think of.
I just want to make sure. Okay. So we usually start with checking vital signs, blood pressure, heart rate, oxygen saturation, temperature, respiratory rate, that type of thing. And then after that, I'll be examining you from the very top down to your toes. Okay?
Sounds great.
Alrighty. So I'm first gonna check your temperature, and that I'm just gonna do this across your forehead. Okay? Run this across your forehead. Alright, your temperature is normal. I'm gonna check what's called your oxygen saturation. Are you comfortable?
Yeah.
Okay. And you did see me wash my hands, right? We're big about infection control around here.
Saw that.
Alright. Alright, your heart rate's normal and your oxygen saturation is great. So happy to see that. I'm gonna check your heart rate while you just relax. And we're actually, like we talked about earlier, filming this for nursing students, so sometimes I'll be talking for their benefit, and you're welcome to ask me questions if you want, but don't worry if I'm talking more than you think I should be.
Okay.
So as I check your heart rate, I'm going to be inconspicuously checking for his respiratory rate, which is nice and normal. I'll go ahead and check this hand too. So your pulse is nice and strong and even and slow. Slow, normal slow. You must be an athlete, maybe, huh? That's nice.
Occasionally.
And healthy. Occasionally. All right. So I got your respiratory rate was normal. I wouldn't be saying that to you, but I'm saying that to the students. And so I'm going to check your blood pressure on both arms. We like it to be close, approximately the same that kind of gives us more information about your health. So I'm going to check your blood pressure on this arm, and then I'll check the other arm. So I'm going to be feeling for your brachial artery pulse, which is nice and easy to feel. Just set this on here. Put this where I can see it. And check your blood pressure. Little tight squeeze, okay?
Okay.
A little higher probably than it needs to be. 120/68, which is really good considering you're being videotaped. I'm gonna come over here, although for the sake of our video person, I'll just reach over.
All right.
Ideally, I would be putting his arm up at heart level, so I would be using like a, I'd be using like a pillow or something underneath there. I'm gonna raise that bed up a little bit. I thought it was a little bit, I'm kind of tall, and I'll lower it back down when we're done. And you're warm enough?
Yep.
Awesome, yeah, thank you.
Just-
I kind of want to put this at heart level. That's gonna be more accurate. All right, I'm gonna feel for that. Feel pulse. Up there. Okay, excuse me. Little squeeze, sorry.
It's all right.
All right. I'm about 116 over about 68, so that is great.
Sweet.
Not too much of a difference, which is a good sign. Alrighty. So you got your vital signs done. We asked you about pain, so we're gonna start on the head to toe part, okay? So I'm gonna ask you questions when I check different areas. Yeah, you can put that back. So, in fact, you want another pillow on your head? So
Sure.
Studying all day, might as well get comfortable.
Yeah.
Okay. Have you, well, first of all, we ask every patient this. It might seem like a silly question, but I already asked you your name and date of birth. I'm gonna also ask you if you could tell me where you are.
Okay. In the Grand
Yeah.
at Grand Ron Hospital.
Awesome, okay.
Mhm.
And, do you know what season this is, or the approximate date?
It's pretty much fall, the end of
Mhm.
summer.
Yeah.
September 16th, 2019.
Awesome, okay, great, thank you. And you know why you're here, because you've already told me that, you're here because you're having abdominal pain, so.
Mhm.
Okay, great. Any problems with your, any past traumas, to your head? Any wrecks
no.
or?
No, nothing noteworthy.
Okay, any, headaches?
No.
Okay, any itching or burning of your skin or your scalp?
No.
Okay, I don't feel any lesions, and your hair seems, I'm gonna talk as I'm doing this too. Your hair looks really healthy and your skin looks really healthy. I don't see any signs of redness or any signs of dry hair, so it looks really healthy. Okay, great.
That's good.
And I'm gonna look in your ears now. Any problems with your hearing or any ringing in your ears?
No.
No, neither of those? Any
No.
issues with your ears at all?
No.
No? Okay. So I'm gonna take a pen light and take a peek in your ears. I'm gonna pull up a little bit, just gently though, and look inside, so I don't see any extra earwax or any signs of inflammation or anything occluding the ear canal. And I don't feel anything on your ear. I'm gonna come over here and do similarly. And I would probably go on the other side ideally, but for now I'm gonna do like this. Okay, now it looks similarly. Great, okay. Well, I'm glad you're having no problems with your ears. How about your eyes? Any vision changes or eye issues?
Nope.
No? Okay. Any burning or dryness of your eyes?
No.
Do you wear corrective lenses?
I don't.
You don't. You're very fortunate. Nice. Okay. Well, great. Well, I'm going to look at your eyes, and at the end, I'm going to shine a light from the side so I don't blind you too much. So as I look at your eyes, I'm noticing the sclera is nice and white. I don't see any signs of varicosities or redness or irritation. The iris are healthy, and the pupils are equal in size, and I don't see any opacities over the pupils. I'm going to take a peek at your skin down here. The mucus or the membranes below your eyes look nice and pink and moist, so that's great. Okay. And we could be doing a more thorough exam of having you look at the chart, you know, but we're not going to do that right now. But you're telling me you have no problems reading or driving or anything like that.
That's
So I'm going
great.
to shine a light. I'm going to have you look away at a distance,
Okay.
and I'm going to shine a light from the side, and I'm just watching for pupil restriction. Okay. It's kind of hard because it's kind of bright in here. Ideally, we'd be turning the light down so that we have a better response. It's kind of bright, but I still see a response. So we're looking for pupils being equal and reactive to light bilaterally, and the correct size. So they're between 3 and 5. So that's the right size of pupil, and they both constrict really appropriately. Going down to your nose. Any problems with smell? Can you smell okay?
I can.
Can you breathe out of your nostrils okay? Both
Yes.
nostrils? No sinus issues?
No sinus
No
issues.
allergies or anything? You're very, very healthy, very lucky that way, aren't you? Okay, so I'm gonna take a look in your nose. You might wanna close your eyes so I don't get you
Oh,
with my
yeah.
light. All right, I'm looking in your nose and I don't see any signs of a deviated septum or any signs of irritation, so that's great. All right, and then how about your mouth? Your lips look, they don't look dry and they look pink, so that's a good sign. Any problems with your teeth?
No,
Any issues swallowing?
no,
How's your appetite?
healthy.
Good, okay, awesome. Any prostheses or anything in your mouth?
No.
Fake teeth? Nope, okay.
Oh, actually, yes, a
Yes?
little bit. Well, just some caps.
Oh, gotcha, okay, and
Some
back on
chipped teeth.
molars?
Yeah, I didn't know the term.
Oh, sorry, yeah,
it's all
yeah,
right.
I have the same, there's probably a story there, right?
Yeah, there's a few.
I think I know the story.
Yeah.
I've known you for a long time, okay. All right, and I failed to grab a tongue blade, so, should we grab a tongue blade or we're gonna pretend we have a tongue blade? Sorry. We'll have a pause.